Have a Seat on the Porch, part two of my conversation with Aimee Surma. It's a wonderful, honest, and a humble perspective that Aimee discusses with us, and she does it with such grace. Aimee, welcome back to Have a Seat on the Porch. So getting back to the beginning, because you just mentioned that, and you're a public health nurse. You've been in public health now for quite some time. Most of your adult experience, your professional experience is in mental health, not mental health, public health.
Right.
Mental health too, but public health.
Yeah.
So being a registered nurse and working in public health, if you can take me back to the beginning when you started hearing about COVID and then the public started hearing about COVID, were those at the same time? And take us through that, take me through that. What was that like? What was that experience for you?
So back in February, Sean and Alexis had gone to a wedding.
And Sean and Alexis are
cousins.
It's your cousin and her husband.
My cousin and her husband, yes.
Mm-hmm.
And so the wedding reception was near my house, and they didn't want to drive all the way home. So they said, "Can we stay the night?" I said, "Absolutely." So I waited up for them. They came over, they stayed the night. In the morning, we were drinking coffee. They were telling me about the wedding, and Sean was getting alerts on his phone, and he's like, "Oh, there's like a virus in China. It's called coronavirus." We're like, "Oh, that's weird." Not thinking anything of it, right?
Mm-hmm.
Thinking like, "Oh, Corona, beer.
Yeah.
So we fast forward to the end of February, and leadership's having all these meetings, right? And then slowly they're like, "Okay, signs went up. You really need to wash your hands. If you're sick, stay home, blah, blah, blah. You don't have to wear a mask at this time." And in the meantime, I had to figure out for my program who could do what. So in public health, the local health departments do respond to any type of public health threat. So that could be mass vaccinations, coronavirus, so swabs, vaccinating, providing guidance to businesses, any like schools, education and surveillance are like the top two things public health does. So epidemiology, looking at the numbers, collecting data from the hospital, collecting data from the community, things like that. So leadership was telling us like, okay, you have all the program managers had to figure out who was going to stay on their program, was your program essential at that time, and who was going to move to COVID. So I'm trying to figure all of this out, right? And we all think, of course, my people need to stay on my program. My program is important. Like we had no idea what this was going to be because it was so new. No one knew. And then I got called onto an assignment because we really didn't have too many public health nurses at the department at that time. And so I was called onto a COVID assignment, right? Doing what we now know is the contact tracing and investigations. So I was doing that before there were forms, before there were directions on how to do it. And it was actually with kids who we thought might have had an exposure. This was before anyone tested positive in the city of Detroit. And to tell you, I think I had to call 13 families, and I followed them for, I think it was at least 7 days. I had to check in with them daily to see if they had any signs and symptoms. They would have to send me temperature checks. Now, these were kids. And I had nothing. I had no reassurance to give these parents. I don't know what this virus at that time, I don't know what it is. We didn't know anybody that was dying from it. We didn't know what it looked like. We only really knew people had a fever, shortness of breath, and a cough, and that's all we were looking for. So 7 days passed, nobody had a fever, everyone was fine. Okay, then I had to start educating other departments. Again, are we gonna be okay? As far as I know, you will be. That's all we had. I don't know. People were angry. People didn't feel safe. And there was nothing that I could do or our department could really do to protect anyone other than say, here's the guidance, this is what we know. Then fast forward to, I had to train, everybody got trained in different roles. I was doing some oversight of contact tracing and investigations, as well as some of my team members. I was still doing like my normal job too. And then everyone transitioned home, except for a core team of leadership and the epidemiologists. And I was doing investigations 8+ hours a day by myself. And I was talking to people who told me they had lost 4 or 5 people already. Some were my age, some were perfectly healthy. And next thing you know, they're on a vent. And I had to call their parents, like, can you tell me their symptoms? And I mean, at one point, I had to call the family of the deceased, several families, and ask about their symptoms. And at that point, that's when I caved, because I had no outlet. Like, I was getting groceries delivered because I thought, I have asthma, so that was when they said, you know, people with chronic lung conditions, things like that. Even though my asthma is controlled and it's more seasonal than anything, I thought I was going to die. I thought like I was going to catch it and die from talking to all these people. And I got to, I would pray with some of the families on the phone. I would pray before I had to call any family member of the deceased and pray for the person who had passed. And it's still like, I tried to listen to mass. I was just like out of, like, literally, if you've ever felt like out of your body, like just going through the motions, like I like, even my body language was probably sitting here just all like trying to protect myself. And that's when I really broke down and lost it on the phone with my mom. Like, I can't do this anymore. I can't. And from there, you know, having that like good cry and having my therapist talking to her about like, I'm going to get this and I'm going to die. That's my fear. Even though I was going nowhere. Like, there was no way I could have been exposed. No way. Yet that irrational fear was in my mind because I was living and breathing, and the numbers, and they kept climbing. And it was just like, it was awful, Billy. It was awful. And then it started to, like, it started to come down a little bit, right? It started to get nicer outside. People had more things that they could do to protect themselves. Like, we know things were shut down for a reason. And I was thankful, like, yes, this sucks, but thank God we're protected. And then from there, you know, I was doing part of my old job, part COVID. And I kind of like, I had to pay attention to my other program because, you know, kids are still getting lead poisoned. It's, and if they're not
Which was your, that was your main priority.
That was my main job, which, you know, is still an issue because we have families that are terrified to still go anywhere. So we know people aren't seeking their like primary healthcare workers or primary doctors to get their checkups, or if they have chronic illnesses, they might not be going because they're terrified. So now we have like this snowball effect of people are getting sicker because they're not paying attention to themselves because they're fearful of getting COVID. And so from there, it started to ease off. And I think once I was in the routine, probably April, when my insurance was like, hey, you can go to counseling for free, I was like, I'm going every day. I mean, I can afford to go weekly, but that was just kind of like, yes. First, yes, I had just started seeing a new therapist, maybe right in January. So we were still building a relationship, and, you know, she's like, well, I have an opening. I was like, okay, fine. Let's just do every day this month. Let's see, whatever. And it took me some time, but I got out of it. And to be honest, I don't know if I've if I would be in this place if I was still doing COVID 24/7. And that's where the guilt and the shame comes in, because I see my colleagues who are at the bedside and, you know, I couldn't do what they're doing. Like, I could not do what they're doing. To know every shift you go in, you're probably going to lose someone and they're dying alone. Like, as a nurse, to have something so out of your hands, out of control like that, and not being able to help and being afraid for your own life, not having the right PPE, for God's sakes. Like, nurses, doctors, physical therapists, respiratory therapists, anyone in the medical field, you know, dietitians, anybody in the hospital, you were literally on the battlefield and still are, because there's going to be residual from this. There is so much trauma right now. There is PTSD. Even after, when things ease up, when the vaccine is offered to the general public and, you know, most 70-80% of the population is vaccinated, it's not going to go back to the way it was.
Right. So what type of PTSD would come from this?
I mean, so let's preface this with, I'm a nurse. I'm not trained in mental health, but I would just assume any type of virus going around that has potential to spread, even just going onto the unit or knowing that you're seeing a patient and you have to wear PPE, or if you get a case in the future, once, you know, it's not so widespread, mm-hmm. that could be triggering. I mean, anything at this point. I don't know how many nurses have actually left the hospital or have gone to another hospital because they didn't feel safe.
Do you know if there's been a shift of nurses retiring, quitting, moving on to other careers because of what they've experienced this year?
You know, I would assume there is. I really don't know. I haven't talked to anyone about that. But I would assume, yes. I would assume people are retiring. People are doing maybe outpatient, or, you know, shifting their focus, or just quitting if they can. If I were a bedside nurse right now, there's probably a ton of people I would stop talking to. Can you imagine, you know, someone who is not taking the proper precautions, who's doing whatever they want? And yes, I understand everybody has an opinion about this. I do. I really do. Can you imagine if someone was just out there doing whatever, going wherever, didn't believe in it, got sick, and then you had to take care of them? Like, it's like, you could have stayed home. You could have stayed home. And now they have to risk their life, and they may have a family at home. You know, medical staff were staying in hotels. They didn't want to come home. Not because they were sick, they were scared to expose their kids. They didn't know. That's back when we weren't testing everyone. So there's a lot of dynamics going on. And for me, the guilt and shame is just not being at the bedside. Knowing that I'm safe at home, making phone calls. I'm not physically working with COVID positive patients, potentially getting exposed. I'm in the comfort of my own home. And that's where my guilt came from. How can we make this better? How can we prevent this? How can we educate the general public about how to stay safe?
On January 17th, Aimee and I are setting up a community conversation. We want to cultivate some deeper connections and relationships to help all of us navigate through our situations that we're currently going through. We encourage you to share. We encourage you to participate. So if it sounds like something you're interested in, please contact us at Instagram, Have a Seat on the Porch, Facebook, Have a Seat on the Porch, at HASOTP. Twitter, you can reach us at Porch Convo, or send us an email through Gmail, haveaseatontheporch@gmail.com. Those pictures are not for me. They're from my daughter, Lena. Please join us. Please message us. We're out here trying to help ourselves, trying to help others navigate through some of the situations that our life has. And yeah, let's do it together. Appreciate it. Take care.